Antidepressant agents, Chapter 21. So what is antidepressant agents? These are drugs that reduce the symptom of depressive disorders by correcting the chemical imbalances of neurotransmitters in the brain. So these imbalances are responsible for the changes in the mood or behavior. So there is a biogenic amine theory of depression. Scientists have theorized that this theory is that depression is the result of deficiency of the biogenic amines. These biogenic amines are the no- norepinephrine, dopamine, and serotonin. Meaning, kapag may imbalance, yun yung nagkakos ng depression. Kunyari, masyadong mataas yung norepinephrine, bumababa yung dopamine, tapos tumataas yung dopamine, bumababa yung serotonin. Depression may also occur as a result of yet unknown causes. This condition may be syndrome that reflects either activity or lack of activity in number of sites in the brain, including the arousal center in the reticular activating system and limbic system, and also the basal ganglia. So, drug therapy. The use of agents that alter the concentration of neurotransmitters in the brain is the most effective means of treating depression with drugs. The antidepressant drugs used today counteract the effects of neurotransmitter deficiencies in three ways. So, antidepressants may be classified in three groups. So, the first is tricyclic antidepressants or TCAs. Second is monoamine oxidase inhibitors or MAOISA. So, there are antidepressants. It is classified into three. First is tricyclic antidepressants or TCAs. Second is monoamine oxidase inhibitors or MAOIS. And the selective serotonin reuptake inhibitors or SSRIs. Other groups or other drugs that are used for antidepressants similarly increase the synaptic cleft concentration of these neurotransmitters. So the first antidepressant drug is tricyclic antidepressant or TCAs. So for its indication, it relieves the symptoms of depression, investigated for the treatment of chronic or intractable pain, and anticholinergic. There is clomipramine for the treatment of obsessive compulsive disorders. So, sa indication nito, sinasabing na babawasan or na-relieve yung mga symptoms ng depression. So, its pharmacokinetics is absorbed in the GI tract. It is metabolized in the liver and excreted in the urine. So its reaching peak level is 2 to 4 hours. It is highly bound to plasma protein and are lipid soluble that allows them to be distributed widely in the tissues. So for its contraindications, we may look for hypersensitivity reactions, recent myocardial infarction, or pregnancy with pre-existing cardiovascular disorders. There is also extra care for psychiatric patients with history of seizures and presence of hepatic or renal disease. So the adverse effect of TCAs is associated with the central nervous system. This includes sedation, sleep disturbances, fatigue, hallucination, disorientation, visual disturbances, difficulty in concentration, weakness, ataxia, and tremors may also occur. For the gastrointestinal effects, these effects are such as dry mouth, constipation, nausea and vomiting, anorexia, increased salivation, cramps, and diarrhea. For GU effects, these include urinary retention, hesitancy, loss of libido, and changes in sexual functioning. And lastly, for the cardiovascular effects, that includes orthostatic hypotension, hypertension, arrhythmias, Myocardial infarction, angina, palpitations, and stroke may also occur as a problem. Drug-to-drug interaction, hindi siya pwedeng sabay sa cimetidine, fluoxetine, ranitidine, and other anticoagulant drugs. There are nursing considerations for a patient who is receiving TCAs. So the first is assess any known allergies to avoid hypersensitivity reactions. Uh, Also, we may consider a patient who is pregnant and or lactating because uh, knowing if a patient is pregnant or lactating, we may avoid potential adverse effects to the fetus or baby. So next is assess whether the patient has history of seizure disorders, a history of psychiatric problems, or suicidal thoughts for the past 24 hours. Uh, knowing the history of the patient, you may avoid potentially serious adverse effects of reactions. Assess the temperature of the patient. Assess the temperature and weight of the patient. This includes skin color and or lesions, affect orientation, reflexes, vision, blood pressure, including orthostatic blood pressure, pulse, perfusion, respiratory rate, and adventitious sound. Also, you may check for the bowel sounds on abdominal examination. This determines the baseline status for beginning therapy and for any potential adverse effect. Also, obtain a electrocardiogram as well as renal and liver function test. Knowing the function of the renal and liver, since it is the main organ used for the metabolism and excretion of the drug. Moving on to the next drug is monoamine oxidase inhibitors. For its indication, it blocks the breakdown of biogenic amines like norepinephrine, dopamine, and serotonin. Its pharmacokinetics is well absorbed in the GI tract. Reaching peak is at 2 to 3 hours. It is metabolized in the liver and excreted in the urine. For its contraindications, hypersensitivity reactions, cardiovascular diseases, abnormal central nervous system vessel or defect, history of headaches, renal or hepatic impairment. Uh, we may also look for pregnant or lactating women. For its adverse effects, dizziness, excitement, nervous, mania, tremors, confusion, insomnia, agitation, liver toxicity, and stroke may also occur. For its drug-to-drug interaction, uh, make sure you don't combine it with thiamine and other pressure amines that are found in food, which are normally broken down by MAOs enzymes in the GI tract, may be absorbed in high concentration in the presence of MAIO, resulting to increased blood pressure. In addition, thiamine causes the release of stored norepinephrine from nerve terminals, which further contributes to high blood pressure, hypertensive crisis. Patients who take MAOI should avoid the thiamine-containing food. So, moving on to the third antidepressant drug, it is the selective serotonin reuptake inhibitor or SSRIs. For its indication, it is said that it treats the symptoms of depression, obsessive compulsive disorder or OCDs, panic attacks, bulimia, PMMD or premenstrual dysphoric disorder, stress disorder, social phobias, and the like. So for its pharmacokinetic, is well absorbed in the GI tract, metabolized at the liver, and excreted in urine or feces. For its contraindications, we may look for hypersensitivity reaction. Take caution to severely depressed patients because taking caution may avoid the potential adverse effects. So, and also check for pregnant or lactating women. For its adverse effect, first effect is on the central nervous system. So for the adverse effect, there is a CNS effect or the central nervous system that includes headache, drowsiness, dizziness, insomnia, anxiety, tremor, agitation, and seizures. For the GI effects or gastrointestinal effects, that includes nausea and vomiting, diarrhea, constipation, and changes in taste may also occur. For GU effects, or this includes painful menstruation, cystitis, and sexual dysfunction, urgency, and impotence. There are also respiratory changes, and that includes cough, dyspnea, upper respiratory tract, and pharyngitis. Others reported that when taking this drug, they have sweating, rash, fever, and pruritus. For its drug-to-drug interaction, combination of selective serotonin reuptake inhibitors and monoamine oxidase inhibitors should be avoided to avoid having high adverse effects. So there are nursing considerations for patient receiving SSRIs. So same as the two drugs, you should always assess for any known allergies to avoid hypersensitivity reaction. Uh, Knowing the history of the patient, we may avoid severe depression and suicide. So you will also check if the patient is pregnant for females and breastfeeding, because we should take caution in these situations, and drug use should be limited. So also assess the temperature and weight, skin color and lesions, affect orientation, reflexes, vision, blood pressure and pulse, respiratory rate, and adventitious sounds. Vowel sounds on abdominal examination for baseline status before beginning the therapy. And for any potential adverse effects. Also obtain the renal and liver function test, because as I've said before, liver and the renal are the organs for metabolism and excretion of the drug. So there are other antidepressants that includes bupropion, desvenlafaxine, duloxetine, milnacipran, mirtazapine, nefazodone, selegiline, trazodone, and a short summary. Depression is a very common affective disorder. It is associated with many physical manifestations and is often misdiagnosed. It could be that depression is caused by a series of events that are yet unknown and not yet understood. And there are again the three antidepressant drugs, TCAs or tricyclic antidepressants, monoamine oxidase inhibitors, and selective serotonin reuptake inhibitors that increases their concentration of biogenic amines in the brain. So the biogenic amines in the brain are norepinephrine, dopamine, and serotonin. So the selection of antidepressant drugs depend on individual or the patient. Uh, that includes the drug response, tolerance of associated adverse effects. Other antidepressants with unknown mechanism of actions are also effective. So thank you for watching this video. I hope you enjoyed and learned a lot in this chapter. Thank you and God bless.